Hi, my name is Rebecca Guerra, and it is currently April 20th. Okay, I hope everyone is staying safe out there and doing good given the current circumstances that are happening all around us right now. As for my UNE case studies connection for Unit 2, I chose case number 3 and case number 4. So I'm going to start with case number 3. In case number 3, it is asking me what is the underlying biochemical basis for the patient, predict the patient's fasted blood glucose levels, and listing 2 regulatory enzymes. In our question that is given in the whole paragraph, there's many key facts I want to reiterate just so to show the patient of what the current symptoms he may be having. So it is started with our patient is a 5-year-old boy that has shown signs of him being a sickly infant from the start. The patient's mother reports that the child has also been appearing drowsy with a persistent thirst. So due to this fact, the thirst, the 5-year-old also has been having frequent urination. We are given a table that shows the comparison of the blood samples taken for insulin measurements after a glucose loading test. And this chart was given us in the question, of course, and from the lab report baseline blood sample of the patient, it is showing to be a 0.8. This is drastically less than compared to the normal value in the control group. And after the 1-hour glucose load, the patient's serum insulin levels are increased to a 5. However, the control group of the normal range value shows it being far too low. The glucose in the blood is not getting to be activated, causing the increase in the thirst for the patient and constant urination visits. So with all this that being said, this is leading me to believe that the underlying biochemical basis for our patient is shown to be diabetes mellitus, or otherwise known as diabetes type 1. Diabetes type 1 has many other names, of course, which can be known as juvenile diabetes, childhood diabetes, and insulin-dependent diabetes mellitus, IDDM. And so, type 1 is when the pancreas cannot produce enough insulin. So without insulin, the blood sugar cannot enter into the cells, causing a buildup in the patient's bloodstream. And so our insulin production, it shows that there is none or very little when the beta cells in the pancreas cannot produce insulin well. This usually happens between the ages of 0 to 40, and so it's mostly young children or teens. In our case, it is a 5-year-old child. And so when doing a fasted blood glucose test for the patient's fasting glucose after the 1 hour given is showing a 5. So this shows that the child's glucose level would then be above the normal range. It is by helping the body cells absorb glucose from the blood. The cells in the patient's body are not able to get the blood glucose, so glucose is the primary source of energy for our patient's body and of course everyone else's body, and it shows that our patient is not absorbing it properly. So with this, gluconeogenesis will likely occur to help make the creation of glucose. And 2 of the regulatory enzymes that are likely to be active would be the fructose 1,6-biphosphatase and glucose 6-phosphatase. And so these enzymes would likely cause an increase in trying to help build in the production of glucose to help bring it into our patient's system. Of course, there is treatment for diabetes type 1 in children, of course. You can introduce healthy eating and meal planning for the patient, increase physical activity. Even though he is a child, he doesn't need to do exercising as much as like a typical adult would, but introducing them to going outside, have fun, play around, of course. There's also blood sugar checks with the patient where we can give him an educated breakdown of what he basically is going through, and of course reiterate it to the patient's mom so she can break it down even further for our patient. And insulin injections can be also known as a treatment, which of course would be an education way of teaching the patient if it would be coming to it if the patient does need it. And so this would be all presented for case number 3 of what I believe would be the underlying biochemical basis for our patient, and overall what he would be basically going through of all these things due to the fact that he was brought in from a pediatric office for his annual visit, giving all these symptoms from the mom. As for my next case that I chose is case number 4. We are given questions and with 4 answer choices, and we have to eliminate, of course, which ones I believe that are not correct. As for the one I chose answer choice C, glycogen storage disease, and this is otherwise known as GSD, which I believe our patient is suffering from. And so in the question it is given, and in the paragraph, there's many key details that can be reported. First, to break down of each answer choices to make sure which one you'd be choosing. And so it starts with, in case number 4, we are able to get the many key facts. So our patient is just an infant with signs of jittery spells after breastfeeding. This implies that the mother is on a breast milk diet for her newborn and not on any instant milk, which is nothing wrong. It just depends on the patient's mom, on what she chose to give to her child. And so with the laboratory results present, it is reported of hypoglycemia, meaning low blood glucose. And so when added epinephrine to our patient, there is no increase in blood glucose, but there is an increase in the blood lactate. And so this shows for the main metabolic pathways in the M1 macrophages induce an aerobic glycolytic program. And so this results in the lactate production. It is the end product of glycolysis. And so all cells can help in the production of lactate, especially with tissues that are shown to have a high metabolic rate. In the physio exam that was given, it revealed a liver edge of 4 centimeters below the right costal margin. And so this shows how the abdomen confirmed of an enlarged liver, otherwise known as hepatomegaly. In the liver, the metabolic state of lactate occurs, and it is only metabolized by the conversion to pyruvate. So this shows the blood lactate levels rely on pyruvate metabolism. However, our patient having an enlarged liver and cannot maintain blood glucose level. So these are 2 symptoms that are shown. So the lactose is shown in as the main carbohydrate in a human milk. So this would be, in our case, the patient's mom. It consists of galactose and glucose, making the enzyme a disaccharide. So going over the patient's symptoms, it is safe to first rule out answer choice A, which is hereditary fructose intolerance. This will then show our patient's ability to digest the sugar fructose. So hypoglycemia and continued exposure to fructose would show the enlarged liver related to the fructose intolerance. However, the patient would also be experiencing nausea, abdominal pain, and chronic fatigue. And in our case, not all symptoms are shown in our patient. As for answer choice B, galactosemia, it affects how the body produces galactose. So the lactate in the mother's milk breaks down galactose and must then be converted to glucose. If infants with galactosemia are not treated, they are shown to show the following symptoms: lack of energy, abnormal bleeding, or yellowing of the skin. And our patient was reported with jittery spells from the mother, and so there shows that there is still energy, and the mother did not report any of the other symptoms present to the answer choice B. As for answer choice D, glucose 6-phosphatase dehydrogenase deficiency is a genetic disorder that affects the red blood cells, and these show symptoms more of anemia or fatigue, dark urine, and a yellowing of the skin again. All these symptoms were not present in the patient from the patient's mom, and these are common symptoms that you would basically see that would stand out for the patient. So these symptoms were not even close, and so we were safe to rule that one out. And the one I chose was answer choice C, which is the glycogen storage disease. And so a little known is like glycogen is a branched chain polymer of glucose and serves as a dynamic but limited supply of glucose, which is mainly in skeletal muscle and in our case the liver. And there are numerous enzymes involved in the glycogen synthesis, utilization, and breakdown within the body. So GSD are a group of inherited inborn errors of the metabolism due to deficiency and dysfunction of these enzymes. And so it is when the body's inability to store glycogen. So our patient is shown to have the GSD where the enzyme is not present to break down glycogen, resulting in the buildup of the liver. This would confirm to earlier where he had the enlarged liver. And so the patient does show that with other present symptoms, including low blood pressure. And so the classification of glycogen, GSD, is based off the enzyme deficiency and in the affected tissue. And so this is also a hereditary disease, meaning the patient's parents passed it down to the 2-month-old female. And it doesn't have to be from just one patient. It can also be from both either or patient, showing in what would be the case. And so this would be, my answer choice would be letter C, the glycogen storage disease for case number 4. And of course in case number 3 I had already presented. So for my online case connections, that concludes for case number 3 and case number 4 on what I believe would be the correct diagnosis. Thank you.